Dr. Stewart, Timonium Foot and Ankle Center. I want to share a story. We have our patient Karen. Karen, thank you for sharing your story with us. Karen was a patient who came to me. She had undergone bilateral knee replacement. And one of the things that can happen after either knee or hip replacements is you can get a little bit of change in the length of your limbs. And she had a little bit of shortening on her left side, which resulted in some pain and limping in your foot. What was going on beforehand?
I was limping a lot, and I was getting cramps in my top of my foot and the big toe.
Okay. And it was suggested that she get an orthotic. And before coming to see me, she actually took a look. She saw the online ads for the Good Feet store. You went into the Good Feet store, and the Good Feet store, just so we can show everybody, you know, they advertise, you know, come in, you have pain, come in, we'll fix you, we'll get everything squared away. And I want to just show that the Good Feet store orthotics, if you can come over here, are just these kind of flat, non-contoured. There's a little arch contour, but there's no cupping around the heel, and they're equal. The heel is completely the same. I did an evaluation of her. I determined that she does have some arthritis in her big toe joint, and I told her that orthotics can certainly be an option that may help her. However, we had to address her limb length discrepancy. And she has a significant difference in the length of her left and her right. So let's come over here again. And we made her an orthotic that contours to her foot, but the big difference is we built up an external heel post on the left orthotic. And the right orthotic, we have an internal heel post, which means that it's going to drop the limbs and let them sit at different heights. Whereas something from the Good Feet store, which is double the price of this, okay, is just an over-the-counter device that would never, ever, ever achieve what we're trying to achieve. When we make these can be remodified, adjusted at no cost to the patient for 6 months. So with that said, we made her orthotics, and they contour to her foot well, they contour around her arch, they contour to her heel, and more importantly, how did you do? How is your pain?
They were so comfortable from the beginning. You know, doctor told me, I'll just wear them for a couple hours. I would forget I had them on. And I'd end up wearing them all day. And the cramp was going in my toe. I have felt so much better.
Right, so I walked in today and she basically said, my limping is essentially gone. And that's a really great experience. And I don't want to mislead. It's usually a gradual process. She's had a very quick process, and I would anticipate she continues to improve. But it's super important for patients to understand what they're getting. You know, when you have an orthotic that's intended to help your foot, it needs to be contoured appropriately. The length and height of the heel, the height of the heel needs to be proper, particularly with this. And it's important that you get into a customized device. And the big benefit of a customized device is if we don't like the way this fits or if it's not working, we'll remake it. And we do that for the first 6 months at no cost to the patient. Our goal is to make our patients happy, and keeping in mind that this is 50% the price of this. And we always, before we ever go into any orthotic, we want to make sure that we treat the condition first and make the orthotic the long-term treatment. Karen, thank you for sharing your story. And I appreciate you as a patient, and thanks for coming to us.
Thank you.
Okay, perfect.